Assalamu alaikum. Now I'd like to discuss about a very interesting topic, that is fibromuscular dysplasia. Look at this system. A 19-year-old woman comes to the clinic. Why? Due to recurrent headache. When we find this young woman with headache, the first differential comes in our mind, like migraine headache, like tension headache. And the patient has had headache for years but thinks that they have recently gotten worse. They last several hours, remit spontaneously, and or after taking over the counter acetaminophen. She has no nausea, abdominal pains, sweating. 6 months ago, the patient checks her blood pressure at a local pharmacy, was told it was high. Her family history is significant for hypertension and diabetes. Blood pressure is 175 by 100 on the right arm, 170 by 102 on the left arm. Pulse is 80. Respiration on examination, she appears to be comfortably cooperative. Okay. A systolic bruit is heard under the ear. A systolic bruit is heard under the ear. Abdominal examination shows no, no tenderness or masses. Which of the following is the most likely cause? This is fibromuscular dysplasia. More than 90% women in adults, internal carotid artery stenosis, there may be recurrent headache, pulsatile tinnitus, there may be transient ischemic attack, there may be stroke, and renal artery stenosis can cause secondary hypertension and flank pain. Physical examination very high yield, subauricular systolic bruit, and abdominal bruit. Fibromuscular is a bruit disease. So, imaging prefer duplex ultrasonogram, CT angiography, MR angiography, catheter-based arteriography. Treatment is antihypertensive ACE inhibitor or ARB the first line, a percutaneous transluminal angioplasty, and surgery. If percutaneous transluminal angioplasty is unsuccessful, then surgery. So this patient with secondary hypertension and due to fibromuscular dysplasia. Fibromuscular dysplasia is a non-inflammatory disease, typically affects the renal and internal carotid artery, leads to arterial stenosis, aneurysm, and dissection. Less commonly, the vertebral iliac and mesenteric artery. Vertebral iliac and mesenteric artery can be affected. In adults, approximately 90% of the fibromuscular dysplasia uh, causes cases occur in women recurrent headache caused by carotid artery stenosis. Recurrent headache caused by carotid artery stenosis or aneurysm is the most common presenting symptom. Pulsatile tinnitus, neck pain, or flank pain are common, and symptoms of TIA, focal weakness or vision loss, may occur. Focal weakness or vision loss may occur. Hypertension results from renal artery stenosis, leading to leading to secondary hyperaldosteronism, and abdominal bruit may be present in younger patients. Subauricular systolic bruit is highly suggestive of FMD, as carotid atherosclerosis should not be present. Even in older patients, a bruit suggests fibromuscular dysplasia, as the subauricular location indicates involvement of the internal carotid artery, which in contrast with the carotid valve and is commonly affected by atherosclerosis. Diagnosis of FMD is typically made by vascular imaging, duplex ultrasonography, CT or MR angiography. For patients with hypertension, treatment involves antihypertensive medication, ACE inhibitor, ARB, and definitive treatment of renal artery stenosis with percutaneous transluminal angioplasty or surgery. So this is a very high yield topic, fibromuscular dysplasia. One of the cause of renal artery stenosis is women in early disease, and in the late cases renal artery stenosis happens in the older patient due to atherosclerosis. Hope you enjoyed.